reinventing surgery means we got to be learning a whole lot of new things really quickly. So I'm really thrilled to welcome Carole Klove to join us today. Carole is a seasoned nurse, attorney. She's been working in compliance. You've got a lot of different things that you've been doing, and right now, compliance, I guess, with UCLA and Stanford. But then your most recent gig is that you are the Chief Nursing Officer for Elemeno Health, focused on communication and microlearning as a service. And boy, are we doing microlearning on steroids right now. So, Carole, I really thank you again for joining us today. And I'm really looking forward to hearing what's been unfolding for you. I can imagine, I know you guys were busy because there's a lot of stuff we need to stay abreast of. Yeah. But I think you guys have seen a level of interest that has been, like, we keep using the word unprecedented, but it, again, is unprecedented. So how about if I let you take over with your presentation, and then we'll go into questions and answers.
That's great, Shauna. Thank you so much, and thank you to DOCSF. We're thrilled to be part of this. We were thrilled to be a digital dynamo at your earlier conference this year. And really, it's a very evolving, fast-moving time, and that is why we need to work on the tools from a digital perspective that'll help us with our real-time education. With that digital, we're going to have to go to the next slide, and we all know the frontline burden. We are building hospitals literally daily. We are learning, as Shauna just mentioned, to do things that we might have learned in medical school, we might have learned in residency, we might have learned in nursing school, physical therapy, respiratory therapy, and it's changed. And now we're asking to do new things. We're asking to do things that are unprecedented. And there comes with that a fear of how you're going to do it and how you're going to do it right. And so that's one of the challenges that Elemeno was addressing before we started with COVID-19. But as Shauna, as you mentioned, it has grown exponentially, that need for frontline training at the point of care. So let's go to the next slide if we can. So why is that need really exploding now? It's exploding because the guidelines are changing literally daily. The standards are changing daily. Supplies, availability, and thinking about all of our orthopedic colleagues who are out participating on this call, those surgical priorities are fluctuating. I know the American College of Surgeons has issued guidance and they issue them twice weekly, breaking up the surgical specialties within orthopedics as to what should be scheduled and what can be delayed, making those decisions based upon clinical competency and clinical conditions, but also that really creates some stress, not only for providers, if they cannot find that information, but also for your frontline office team who is trying to support all of the providers in this, in our community. The other thing that's challenging with regard to the standards is that ventilatory capacity and what's being changed and who is being asked to do using ventilation. Staff are being floated to the greatest need, and that cross-training that we always needed, but we sometimes thought we had a classroom that we could send them to for a little bit of training, is now having to be done at the front line. As I was talking to one of my colleagues yesterday, and in the news, we're always talking about the war that we are facing, which is really the war on COVID, something that we have not seen, and it is unprecedented. We're graduating medical students early. One of my friends, her daughter's an orthopedic resident. She's been floated to the emergency department, which is certainly different than what she had planned on training for, and asking to do things that she didn't anticipate. How is she being able to be equipped? Nursing students are graduating early. the same. They're being put into the front line. And when we think about war, if you were drafted in the war, you maybe go to base boot camp. We don't have a boot camp for these folks. We're doing it real time, and that's why we need real time tools. In addition, what is really important that we have found as we've been working with our clients for the last 3 years, and I know it's taken place before that time, is that sometimes communication is not centralized. You've got SharePoint, you've got other kinds of opportunities to share information. But in times like this, it's kind of given an explanation point that the frontline teams need one source of truth, and they need it in the palm of their hands, because it truly is impossible to remember every procedure or protocol. Let's go to the next slide. If we can. Maybe we can. There we go. So when we, and Stefano talked about this in one of the earlier sessions, moving from kind of analog, which is where we have typically, many of us have been in, thinking about training and education and communication. We've got binders, SharePoint sites, all of the emails, and not to mention posters in the bathroom, because that's sometimes the best way to capture someone's attention. Staff are overwhelmed, they're unprepared, and they're stressed. We see that in the news when every newscast is interviewing a nurse, a doctor who has really never experienced this before. Teams are having trouble separating signal from noise. And they're already working overtime. So, many are running PPE classes and the like. They're already working overtime. They cannot seem to attend one more PPE class. Plus, it's all about social distancing when you have that. So let's go to the next slide, and we talk about, our world. In the outpatient world, thinking about just our ambulatory patients, and if we focus on even just the orthopedic specialty in particular, we're now screening our ambulatory patients for COVID before they come in and be seen, if you are having clinics. And if that's the case, you've now teaching your new ambulatory staff, what does that screening mean? That's a new workflow that they have not had before. In order to have it consistent across your entire clinical enterprise, you need to have some simple workflow, a decision guide that helps staff with that. In addition, thinking about learning and using telemedicine, I know that everybody's doing that, and that's great. And that's really helped to serve patients, particularly post-op patients. But it also comes with new workflows, Zoom meetings or whatever it may be that's being set up, and just educating the staff. Flip side, we've already talked a little bit about what are some of the challenges and changes in new patient. There's now need for creation of algorithms for surgical needs. Are they emergent? Are they urgent? Can we put them off? And what happens when we put them off? We're going to have a boatload of people that are going to need their operations. Surgeons, and you all know who are on this call, are now pivoting to also sort of support the intensivist role at times. So you're learning how to manage a ventilator or to support your intensivist colleagues with some new processes that it understandably can create some fear to make sure that you're doing them correctly. So how do we pull all that together to pivot, to change the needs and to develop those processes to support our front lines? So let's go to next. So I think that's as Shauna said, that's what COVID-19 not only created this sense of urgency for everyone, but spotlighted the need for disruption. And I know that Stefano said it may not be disruption, but I think there was a need for some disruption as it related to training and communication tools. They need to be innovative. They need to really respond so that there is one source of truth. It is actionable, our goal is to get the right information into the staff, keep them secure, share best practices, and leverage those best practices. And by doing so, leveraging that best practice, and what we have seen is our at UCSF, for example, where we are working hand in hand with the emergency department as well as some of the other departments at UCSF. But in the emergency department itself, we were working with them before COVID-19. COVID-19 came and it became the source of truth. Jean Noble, who is the ED director for emergency preparedness, medical director, said it would have been critical. Without Elemeno, that has been critical to our success. And the reason is because it gives them the ability to update it daily with information, daily with regard to content, update on swabs, update on screening. When they set up the the tent outside of the emergency department, update on workflows that impact the environmental services, the nurses, the physicians, security, so everyone can come together and know what their job is for that day. And that's incredibly powerful and important. And also, as Shauna was saying, we're learning new things. So create that short video or a picture, how to swab a patient, how to change a central line dressing if it's something that you've now floated to a unit and you have not done it in a long time. Making that easy, accessible, reduces the fear, improves the consistency of practice, which helps to drive the improvement of outcomes. And that's one of the important things that we're trying to do, is to elevate that care. And then by sharing practices, all of a sudden, a couple of the affiliates of UCSF got really stressed because of the fact that they were having patients come in and they didn't have all of their tools put up. What that allowed us to do is to work with those affiliates, and literally with one affiliate, Sonoma Valley, we met them at 9 in the morning. By 6 o'clock in the evening, their site was up and their content was up and their staff knew where to go and were able to use the content really that was from Elemeno, from UCSF, leveraging it on Elemeno. So they had a video on PPE, donning and doffing, or swabbing, or workflows, or having the CDC link right there so that they could pull up the CDC form, print it to their local printer, and it's all in one spot. It makes life so much easier. And it really reduces the stress and creates that team consistency, which is so important in these times. Next. So when we talk about real-time tools, we're going to drive better training, better communications, and better outcomes. I think it's just the ability to enhance that communication will enhance point of care training, sharing those practices to really democratize it. Because when we think about what we're doing now, we think about how are we slowing the spread? We're slowing the spread by all of us doing the same thing. How can we improve care for our patients that come into the hospital, COVID positive or not, by using consistent best practices across healthcare in a simple, clear decision guide or some other method? But that just makes it a little bit easier. So we're trying to improve patient outcomes with that real time. And it's as Shauna, as you stated, and I think this is the end of the slide so we can get into discussion, but that has really elevated the entire need for looking at how we communicate, looking at how we train. So with that, I think there's one more slide if we want, but we don't have to put it up.
Oh, I was going to say, if there's one more slide. Okay.
just talking about us. So I don't want to give a commercial. I just want to.
Yeah, no, well, it's good to be able to see what these things look like, because we can talk about it in the concept, but then, from the standpoint of the, you've got this idea in your mind, but then when we talk about it, it's really good to see what it is that you're referring to. So, all right. So there are so many different questions right now. And one of the things that we get a lot of questions about is thinking about the multiple generations in the workforce. And so not only do we have different ways that everybody learns, but we then have that exponential where we've got 5 people who learn 2 ways. Now we've got 5 generations, and each one of those generations, that as we've added generations, there have been new ways to learn. So it's an exponential change in how we are learning individually, but then also learning as a group. So can you speak to how does this tool really help to address the multiple generations and the multiple ways that people learn?
Absolutely. And that when Elemeno was developed, it was really developed because we use technology in our personal lives. Why don't we leverage the same way we use it in our personal lives for this? Thinking about the different users, and we literally could have 5 generations working on the same unit.
On one team? Yeah, okay.
On one team. And so some will learn by a video. Just give me 2 minutes how to do it. Some will need a checklist. Some will actually want to read the entire policy. And some will be a combination of both, looking at a screenshot or something else that will help to drive that into their mind, or a combination of others works, And so as learners, when we put a navigator together, or a tool together, let's say on Central Line, or let's say on COVID, it will have a combination of one or all of those, depending on the complexity. And that then helps to drive that learning, because it is broken up. And so you will see a video, or you can just pop down and look at the screenshot, because I can't remember how to document it.
What the setup was or something like that. Yeah,
exactly. Or what is the 5 things that I need for this before I go into the patient's room? So all of those things, and that's more important now than ever, because you can't don and doff all the time. You are really literally trying to collect all of your supplies and then go back into that patient's room.
So that really is micro. When you say micro, it's like, if all I need to know is what was the setup, that's all you need to go and find.
That's all I need to go and find. Or if all I need to go and find is how to swab a patient or to set up the EVD, that's the only thing I need to look for.
Okay.
So building it into those bite-sized components, making it digestible, makes it easy.
All right. So within specifically orthopedic surgery, what are the micro-learning needs for orthopedics?
The micro-learning needs, I think, for orthopedics, and we've got some of them already built into our solution, relating to and non-COVID related versus COVID related. For COVID related, it is good to know how to do the screening and what are the forms and how to complete all of those things. On the non-COVID related, it's how do you for nursing, how do you set up a fixator, or how do you do some of those things that are repetitive? How do you put a screw in? And I remember speaking to one orthopedic surgeon who said, gosh, I wish we had, I just did this because nobody else knew how to do that. But we would be able to transfer and leverage that expertise, which is what we're trying to do, leverage the expertise across the entire enterprise, so that one person who knows how to do it better than everybody else that knowledge can be shared and spread. So whether you're working at 3 a.m. or at, on a Saturday, or 5 p.m. on a Monday, you can tap into that resource without saying, Shauna, I wish you were here, because you're the best one to do it. Yeah.
Well, and the other point that you brought up with one of the major changes is that we're asking and inviting and requesting our medical students and our nursing students to graduate early. They're graduating early. Many of them are not planning on going into ICU or ED or infectious disease, any of those types of things. But in addition to losing a certain degree of their training, many of the people in orthopedics that they would be training with are not there to help them train. So how would the micro learning work from the standpoint of this interesting gap that we have where a new set of learners and the teachers that they have aren't coming together at the same time?
Sure. So what is helpful? Well, what helps with that is really making onboarding into a micro learning. So that you've got those nuggets to help them be prepared. So really that you're now giving them in the palm of their hand or on the desktop a preceptor that's in their pocket so that they can go and access it. And it may be, just a simple document that shows all the different people who are on call that day, or photos of the team that you are working with. And when you're a nurse or a provider that's floating, that's invaluable because all of a sudden you land on a team, you don't know the code to the med room, you don't know the code to the break room, and you don't know even who's in charge. And if you can have that information at the palm of your hand, it's powerful.
Yeah. Well, we've been talking a lot about the learners. We've got a lot of teachers. And there's a whole lot of new things that we're learning. So in this COVID environment, one of the questions that was in there was, how quickly can you turn around a lesson? So let me turn that into two parts. Okay. Who are our new teachers? And once they've got a lesson, how quickly can you turn that around?
So our new teachers are those that have the best expertise. And in COVID, it's really a change. But it could be our emergency department because they're the front line who are dealing with some of these things. It could be our ICU team, our intensivist, who is now needing to share his or her knowledge about how to do a specific intubation, or it could be something less complicated than perhaps that, or how to do event setting. And we do it in micro learning, as I said. So it's no more than 1 to 3 minute video. It's similar to what YouTube would do. Very short, very concise. So what we work with our clients is that they will then usually videotape it very quickly, send us the content. We will not only package it and transcribe it and usually get it back to them in a day, maybe. So very quickly because it is evolving so quickly. But that gives them the rapidity. Now, sometimes it's rather than that, they've got a very complex decision guide. We've all seen them, workflows that you just look at and you go, okay, that's not going to happen very quickly if I look at it for the first time. So what we will do is take that and really put it into an algorithmic decision guide. So as a provider, you're saying, okay, they're on this setting, perfect. I checked that. That already takes me through this otherwise very complicated maze.
Well, and you just seeded my next question, which is adoption. So, great that we've got this new lesson and we're turning it around. We all know that adoption is really hard, and there are plenty of websites that we direct people to, or there's a handout, or somebody sent an email, or there's a webinar or conference. How are you helping to drive adoption and make that adoption curve easier and faster?
Well, the adoption curve has been actually pretty easy because, thinking about our youngest generation, they've literally had the phone in, since it was in their diaper. Yeah. I mean, so for all of us who are a little bit older, we still have the phone with us hand in hand, right? And so consequently, the adoption has been simple because it's intuitive. It's no different than how they would access and pull up information on their phone. And we're so used to now doing Google Forms or checklists that it really is using a very practical, engaging approach. And one of the co-founders at Elemeno was a gamer. Yeah, and so he brought that gaming bent to drive the engagement. So as a component of this, which I think is equally important, right now we've got staff that are stressed. They need that pat on the back in a very powerful way, thanking them for the teamwork that they're doing. And so integrated with our solution is a recognition component so that I can say, Shauna, thanks for being here this night. That is seen by everybody. People can like it, no different. And that boosts morale tremendously.
So you've gamified it then?
We've gamified it.
Yeah, all right. So you can have a leaderboard.
We don't right now. Nobody's really interested in having shift against shift, do some games to drive adoption. We have that right now. People are just diving into it because they want that source of truth and they want it easily accessible to them so they can deliver the best care and keep themselves safe.
So we've got a question here from Terrence. He says, creating digital content takes time. How do you create quality content in a timely fashion, but yet make sure that it's fact-checked? If you allow all the team members to add content, how do you control the accuracy?
Well, the content right now, well, we've got a couple of different ways. We do have some limited ability for our clients to update content, and usually it's with either a physician's doing it or the nurse leader's doing it or the nurse educator's doing it. If it's adding content, that still is coming up primarily through us, and then we will update that content and use that content. And one thing that we will always do, and certainly it'll get approved by the client before it gets posted, but we also put the source of truth so that there will be a link to the source of truth. So that wild decision guide that I showed you that looked like spaghetti on the wall, that will be there. So if somebody really questions that connectivity, they will be able to, is that really right? They can go to the source of truth, because it's important that we're not content, we're facilitating digitizing that content to make it smooth and easy for the front line.
So who's been your most active contributors?
All of our clients are really active contributors.
So it's not one specific, like it's not the nurses or the surgeons or the respiratory?
I would say it's kind of physicians have been involved. Certainly nurses are a larger population of providers. And so as a result, the nurses have been probably the leading provider in terms of content. And then in addition, the respiratory therapists, because they really, at one of our clients, they support all of trachs and evaluating trachs and what sizes to use. So they put a great compendium that all the ENT and the physicians can use to ensure that the right care is delivered. And that's in a children's hospital. So that makes it a little bit more specific.
And then the other thing that I was thinking about specifically in the orthopedic space is there's so many times when we send people home who have a drain, have a dressing, there's so much that's done in the home care. How are you using your libraries to educate the post-op care that happens in home? That's
great question. And as it relates to the content that we have, and of course our library is growing, but there is content that the staff can then show the patient before they leave. The same discharge, they're doing a wound dressing, they're doing a wound vac change, whatever it may be, they can then share that and show it to the staff member and the patient and the family to do a teach back in the patient's room. And then we've got capabilities to send the similar link to what that content is. That's still an evolving process, because remember, we are a growing company. So as we see an identified need, because there are some great resources already out there for some of that training, but to drive that consistency of practice, to reduce practice variation, that's certainly something that we are building upon and staff are using.
So I am, my supposition here is, in a time of COVID, we really need a shared library because things are changing so rapidly. And from the standpoint of who's seeing what and who's learning first, like I said, that's my supposition. But can you speak to the importance of a shared library?
A shared library and that was one of the premises. We want to democratize healthcare in terms of those shared practices, because we all should be striving for our very best. And there are some folks that have gotten a little ahead of the curve. UCSF was one of them in terms of COVID preparedness and just COVID practices, and they continue to evolve. And so being able, as we have, to share them with our clients, which they're willing to do, it not only helps to drive that consistency of practice, it also reduces the angst at that client who hasn't quite developed those yet. And they can look at it and say, we love steps 1, 2, 4, 5, and 7. We have a little bit of a different tweak for 6 and 3. We'll modify them, but it's a starting point. It's a platform, and it allows them to customize it to their specific needs. But you're absolutely right. A shared library, if we could grow this so that everyone could build off of that shared content, hey, who are you? That would be fantastic.
Well, it has been incredibly helpful to be introduced and understand more about how we're all learning together and we're all learning rapidly and what resources are available to us. So I just wanted to thank you again for your time. I know that you guys are insanely busy. You have a lot of people who are reaching out to you, and you're learning just as fast as you possibly can so that the rest of us can learn right along with you. And we're just going into new territory and having to rethink how orthopedic care, primary care, all of those, actually somebody just asked. But anyway, so thank you very much, and let's say goodbye. And it's been great.
One more thing, if I have 2 seconds, do I have 2 seconds? Sure.
Mm-hmm.
So I was going to say, I think one of the things that helps our platform, that helps some of the learning platforms like ours, is that we don't need PHI. So we don't need patient protected health information. So that makes it very lightweight. And many of the colleagues in the IT department in the hospitals that we're working with say, you don't even need to talk to us. So that makes it, I think that helps too, to make that dynamic work. So anyway, I think that the shared library is helpful, and that's makes it all worthwhile. So thank you for allowing me to visit with you today.
It's been great. So anyway, we're going to go head over to the next session. So I hope you'll join us there. And I'm sure that there are going to be more questions. Great. And it's been, like I said, really appreciate all the work that you're doing and helping us to learn as a community. All right. See you guys in the next session. Bye.